So it will break a manifesto promise. Is it the answer to the reform of social care? Somebody who's been looking over this is Jane Townson, former CEO of the company Somerset Care and now current CEO of the United Kingdom Homecare Association. Good morning to you, Jane.
Good morning, Claire.
What do you make of the increase? Is it the answer that those within the sector were wanting to hear?
Well, it's been billed as a means of fixing social care, but as far as we can see, it's nothing of the sort at the moment. Of the 36 billion that will be raised over 3 years by the increase in national insurance contributions, only 5.4 billion is designated for social care. And this is nowhere near enough. We're experiencing the worst shortage of care workers anyone can ever remember. Our care workers are stretched beyond any kind of reasonable limit. And underfunding social care will have a direct negative impact on the NHS too, regardless of how much money the government throws at it to appease voters. And right now, the NHS is struggling to discharge people back home into community services, and by neglecting older and disabled people in the community, waiting until a crisis is reached, then moving them into an acute hospital where quite often they end up losing function and require even more longer term care, isn't really helping the situation. We've got the investment in the wrong places. We need to invest at the front to prevent deterioration rather than just waiting until the deterioration has happened and then throwing lots of money at it.
But if for the first 3 years, the majority of that £36 billion is going to be spent on trying to solve the backlog that has been faced because of this pandemic, surely won't that help relieve pressure on the NHS? And therefore that will have a knock-on impact, a more positive impact on social care. Without clearing that backlog, everything's affected.
That's true, but we've got a real big workforce crisis now, and if nothing is done, there won't be enough support and care when the NHS is finished with its backlog. But they need the beds to be free, and at the moment they can't move people who are medically fit for discharge back home. And even in Somerset, people are being placed in care homes because there isn't the capacity in home care, and that isn't good. People want to be in their own home and surrounded by the people that they love, feeling comfortable in the environment that they know. So we really need to get people back home as soon as we can and to keep them there as well as we can for as long as we can.
Is this not a start? Surely it's unreasonable to think that all of social care's problems will be fixed with one announcement within a few years.
Sure, and there will be a lot of work in the coming months. We'll be working closely with colleagues in the Department of Health and Social Care, Local Government Association, Association of Directors of Adult Social Services, and our care sector partners to try to chart a path forward. And it is a positive step forward in the sense that the Prime Minister, the Chancellor of the Exchequer, the Health and Social Care Secretary have had the resolve to push through this reform in the face of quite a bit of backlash from their own MPs. And I think what we've missed really is a conversation with the general public about our expectations for our health and care needs and how they're going to be met. And a lot has been said about young people footing the bill, but actually already half of the social care budget is spent on under 65s. And we all need to see this as a long game. Right now there are 1.6 million people over 85. By the time I get there, there'll be more than twice that number. If we can't cope now, how are we going to cope when there are more than twice as many older and disabled people needing support? So all of us need to invest and pool the risk, share the responsibility so that we can all share the benefits too.
To improve the staffing situation, as you mentioned earlier on, the lack of staff that the sector currently has, does that solely come down to money and an improvement of wages to make the job more attractive?
Money is obviously a key factor because we need to get wages above the legal minimum. And we also need to create a career structure, which other countries have done for the care workforce. But it's also how the money is spent. successive cuts to council budgets over the last decade have led to commissioning and procurement practices in some areas, not in Somerset, I hasten to add, but in some other local authority areas, councils are purchasing home care by the minute.
So can this levy help with that then? Can this levy help with that?
Well, in the short term, there's just not enough money going. There'll only be 1.8 billion extra per year for social care for 3 years. That isn't going to scratch the surface. So the Health Foundation did some calculations, and the figure roughly of 12 billion has been proposed as the sort of amount that we'd really need to make a difference. So we're way off that. Whether that will shift, I think everyone's concern is that once the NHS gets used to spending that kind of money, they're not going to give it up in a hurry. There'll be resistance from the public to increasing taxation further. So will social care forever be, at the bottom of the pile, struggling to keep going?
Do you feel as well that enough is being discussed when it comes to, because I know it's all very well talking about reform, perhaps maybe more workers, more money, but the quality of care that we will see in the future? Do you think the care sector has been listened to, and what should members of the public be talking about when it comes to the quality of future care?
Yeah, well, this does tie into both the funding and the way that care is commissioned and purchased. But our fear with this reform, well, as it currently stands, is that people will still find it hard to access state-funded home care services. Quality, choice and control will still not be where it needs to be because of budget constraints, the lack of capacity to meet needs. And, the workforce is a real issue. We're still not fully harnessing the opportunities from technology. And I think very crucially, there isn't anything yet about how to support informal unpaid carers. And you may remember that a couple of years ago, we did filming in Somerset with Panorama. And that really highlighted the difficulties, challenges and misery often faced by loved ones caring for relatives without enough support. And there's at least 9 million, if not more, informal carers in the country. And we need to do more to support them as well. Okay. Government says it's going to consider that as part of the reform agenda, working forward in the autumn. They say there's going to be a white paper. So we'll be lobbying hard together with organisations like Carers UK to make sure that informal carers, as well as professional care workers, are front and centre of the reform, so that people receiving services receive the quality and access to the care that they need.
Jane Townson, thank you very much, CEO of the United Kingdom Homecare Association.